Um, so my name is Alexandra Alizadeh, and I am the founder of Adviise. With Adviise, we're really creating a centralized platform where any patient in the country can find any doctor based on location, compare the reviews, availability, education, training, where the doctor is on staff and has hospital privileges, and the patients can then book in real time without having to make a phone call. And we've also launched our own telemedicine platform so the patients can both schedule and be seen in the same place. So I think the benefits of telehealth really are access, autonomy, convenience, and safety. Patients really shouldn't have to wait what can be weeks or months for an appointment. And we've seen telemedicine enhance patients' ability to most effectively manage their care when it's done both safely and securely. During an office visit, for example, a provider could be jumping from room to room, not only and only to seem distracted when they're with you. Telemedicine gives providers, too, the opportunity to better manage their time and be fully engaged during consultations. And this focused time, I think, really, enhances the patient experience and outcomes. And in terms of chronic, illnesses, or really many conditions can be safely monitored remotely. And immunocompromised patients specifically risk their health when the only option is to see their provider in person, not just in waiting rooms, but in public transportation, arriving, leaving. I mean, it's very risky, and any ill patient can be seen without having to leave home. And 50 years ago, we had house calls. Doctors made house calls, and we've seen that come full circle now with telehealth. I think before COVID-19, telemedicine was more of a fringe practice. It did exist, but it was not widely used across medicine. And I compare it to something like online learning, distance learning, not yet really mainstream. And its convenience makes it seem almost a little bit too good to be true. But COVID-19 really drove this accelerated adoption, and we realized that patients were embracing this, and it may really work, and in some cases, maybe even more beneficial than going into the office repeatedly. So let's take rare and chronic illnesses specifically. If you live in a small town or a rural area, your chances of finding, a provider and that specialty care that you desperately need close to home are really slim to none. And with telemedicine at your disposal, you really have access to perhaps a leading physician with specific training and knowledge and experience concerning your rare condition, and you can have this one-on-one time with them, and you can get real answers that you wouldn't otherwise. A patient, they can review lab work, they can order prescriptions, they can order imaging, everything else can be done if you just don't have to go in. And a patient really should avoid exposure to others if they're at risk or others are at risk, or potentially have an active disease. And if they can be monitored remotely, they really should be when it's possible. And telehealth really provides that option. It really expands access to providers. So, allowing them to see one of the top experts in their field, potentially. If take a state like West Virginia, there's really only one major health organization, and that's the university. But it's far away from most people in the state, and you're not able to get the care that you need if you're living in a small town that only has, sometimes rural areas only have community medicine, which is, they'll have not even a physician but a paramedic who acts as a healthcare worker for that area, and that's really not sufficient for someone who has a condition that they really need, extra care for. They're not equipped for that. And if you're able to see one of the top experts in your field, they can review results, they can consistently monitor progress, they can address any setbacks with a change in medication or diagnostic imaging, and as long as the patients are diligent in monitoring their symptoms, and reporting to their doctor as they normally would, albeit virtually, there should be no diminished quality of care. It has a lot of research potential too, because the problem with diagnosing rare diseases is that there hasn't been enough research done in order to best care for this patient. And if you have everybody coming to one physician or just funneling towards the experts, they're able to kind of say, okay, I see a pattern here. Okay, they're just, instead of it being parsed out to all this different community care providers, if it's going straight, to the expert, then they're able to do more research and publish and, bring more, they bring more attention to the patients who are really suffering, and hopefully treat them.